The silent architect inside your chest is building something that will kill you, and your doctor has no idea it is happening right now. There is a blister forming inside your arteries at this very second. Not a clog, not a blockage, a living, breathing, volatile blister. And unlike a normal blockage that builds slowly over decades, this one can rupture without any warning and stop your heart in under 60 seconds. The terrifying part is that millions of people have had perfect cholesterol numbers on paper the morning before their fatal heart attack. So if cholesterol is not the real killer, what is? And why has heart disease remained the #1 cause of death on Earth for over 70 years, despite every drug, every surgery, and every breakthrough modern medicine is thrown at it? The answer is something your cardiologist has almost certainly never discussed with you. It is called soft plaque. And once you understand what it is, how it forms, and what specific foods can actually dissolve it from the inside out, you will never look at your breakfast the same way again. Stay with me, because what you are about to hear has the power to add decades to your life. And it starts with a mystery that has puzzled scientists for over a century. Here's what nobody tells you about heart disease. We have been fighting the wrong enemy. For decades, doctors focused on hard, calcified plaque, the stuff that clogs arteries like rust in an old pipe. We invented statins to crush cholesterol. We performed bypass surgeries to reroute the blood. We declared war on smoking. And yet more people are dying from heart disease today than at any other point in human history. Dr. Neil Barnard, president of the Physicians Committee for Responsible Medicine, puts it bluntly. Our diet in America and much of the modern world is probably the worst it has ever been. We are winning every battle and losing the war because we never identified the real battlefield. So let us go inside your chest right now and look at what is actually happening. Your coronary arteries sit like a crown on top of your heart, branching down into the muscle like tree roots, delivering oxygen and life with every single beat. When those arteries are blocked, the muscle below does not just slow down, it dies. That's a heart attack. But here's where the mystery deepens. The thing that causes that blockage in the majority of fatal heart attacks is not a thick, hardened, years-long buildup of calcium and fat. It is a soft, unstable, cholesterol-filled blister sitting inside your artery wall. Think of it like a water balloon with a thin membrane. On the outside, that artery can look almost perfectly normal on a scan. Doctors can miss it completely. But when that balloon ruptures, it dumps its contents directly into your bloodstream. Your body panics and sends clotting agents to seal the wound. That clot grows until it completely corks the artery, and in 60 seconds or less, a perfectly functioning heart is stopped cold. This is the silent architect, building its destruction quietly, invisibly, until the moment it is too late. Now here's where cholesterol comes back into the story, but not in the way you've been taught. Your body actually needs cholesterol. It's the raw material for testosterone, estrogen, cortisol, and vitamin D. Your liver makes it naturally because it's genuinely essential for life. The problem is not cholesterol itself. The problem is what happens when you flood your system with more than your body can possibly use through animal products and saturated fats, and when those excess cholesterol particles get oxidized. Oxidation is the mystery trigger that transforms harmless cholesterol into a biological hand grenade. An oxidized cholesterol particle is a damaged, unstable molecule that your artery wall treats like a foreign invader. Your immune system rushes in, inflammation begins. Your artery wall swallows the oxidized particles and forms that dangerous blister to contain them. This is not just happening in your heart. This same process is happening in your brain right now, quietly setting the stage for stroke. It's happening in your legs, causing chronic pain and circulation failure. And in men, it is collapsing the delicate blood vessels responsible for sexual function, because those vessels are among the smallest in the body and show damage first. The plaque doesn't just appear, it is constructed brick by brick every single day by the food choices you make before 9 a.m. But here's the part of this story that changes everything. For decades, cardiologists believed this process was completely irreversible. Once the plaque was there, you managed it, medicated it, and hoped it didn't kill you. Then history handed us the most accidental clinical trial in medical history. During World War II, when Nazi occupation forces seized meat and dairy supplies across Europe, millions of people were involuntarily forced onto a plant-based diet. Researchers noticed something extraordinary in the mortality data. Deaths from cardiovascular disease dropped off a cliff. And when the war ended and meat and dairy returned to the dinner table, the cardiovascular death rates climbed right back up with them. This was not a statistical coincidence. This was biological evidence of reversal in action. Then, in 1990, Dr. Dean Ornish published a landmark study that rocked the medical establishment. Using nothing but a plant-based diet, exercise, and stress management, with zero surgical intervention and zero cholesterol-lowering drugs, he demonstrated that in 82% of patients, arteries that were previously blocked actually opened back up. The plaques shrank, the blood flow improved. The reversal was real, measurable, and reproducible. But the critical detail buried in that research is this: you cannot do this halfway. A semi-Mediterranean diet with a little olive oil and some fish twice a week will not reverse arterial disease. It might slow it down slightly, but slowing your constriction is not the same as tearing the building apart. True reversal requires the full biological power of a whole food, plant-based approach. So what are the specific foods that act as your body's internal demolition crew? The first weapon is the soluble fiber trap. Your liver is constantly pulling cholesterol out of your blood and sending it down to your intestines to be eliminated as waste. But here is the problem. If there is no fiber waiting in your gut, your body simply reabsorbs that cholesterol and sends it right back into circulation. When you eat oatmeal or black beans, the soluble fiber acts like a molecular sponge. It physically binds to that cholesterol in your intestines and drags it out of your body as waste before it ever gets a chance to return to your bloodstream. Every bowl of oatmeal is an active cholesterol elimination event, and the black bean is the most underestimated weapon on this list. It delivers a combination of soluble fiber and anthocyanins that simultaneously trap cholesterol and protect your arteries from the oxidation that triggers soft plaque formation in the first place. The second weapon is the nitric oxide flex. Your arteries are not passive pipes. They are living muscular tubes that expand and contract to manage blood pressure and direct blood flow exactly where it needs to go. The molecule they use to do this is called nitric oxide, and as you age, your body produces less and less of it. This is why blood pressure climbs with age. Green leafy vegetables, particularly arugula, spinach, and broccoli, are loaded with nitrates that your body converts directly into nitric oxide. One critical warning: boiling your greens destroys most of these nitrates by leaching them into the water. Steam them or microwave them to preserve the full artery flexing potency. The third weapon is the athlete's secret. Beets are the concentrated, turbocharged version of everything leafy greens provide. The nitrate density in beet juice is so powerful that elite endurance athletes use it as a legal performance enhancer before competition because it measurably improves oxygen delivery and blood circulation. But for someone with cardiovascular disease, beet juice is not a performance enhancement. It is restoration. It is returning your blood vessels to the natural high-performance state they had decades ago, before the damage began. The fourth and most targeted weapon is the soft plaque dissolvers. Blueberries and strawberries contain exceptionally high concentrations of anthocyanins, the same compounds found in black beans. But berries deliver them in a form that directly targets the most dangerous stage of arterial disease. Soft plaque, that volatile water balloon, is the most threatening form of cardiovascular buildup because it is the most likely to rupture. Anthocyanins from berries help stabilize the membrane of soft plaques, reducing their volatility, and over time work to shrink and dissolve them. A daily handful of berries is not a wellness trend, it is targeted cardiovascular therapy. Now let us talk about the two hidden setbacks that most people on heart-healthy diets are sabotaging themselves with, without knowing it. The first is the olive oil myth. Olive oil has been elevated to near religious status in wellness culture, and compared to butter or lard, it is a better choice. But olive oil is still 14% saturated fat. It is a processed food with all of the fiber and protein of the olive stripped completely away. In actual clinical studies comparing Mediterranean diet followers who used olive oil freely against people following a low-fat, whole-food, plant-based approach, the Mediterranean group lost 0 pounds over 16 weeks and showed no reversal of arterial disease. The whole-food, plant-based group saw dramatic weight loss and measurable improvements in arterial health. Olive oil is not a health food. It is a less harmful fat. That distinction matters enormously when your goal is reversal. The second is the nut paradox. Walnuts and almonds are genuinely nutritious. The research on their cardiovascular benefits is real, but they are so calorically dense that when people eat them freely as snacks, they consistently stall weight loss and can significantly interfere with reversing insulin resistance, which is itself a major driver of cardiovascular disease. If you want to include them, treat them as a flavoring ingredient, not a food. 1 ounce, the amount that fits in your closed palm, crumbled over your oatmeal or scattered across a salad, not a fistful grabbed from a bag while watching television. Here is the question everyone asks at this point. How long does real reversal actually take? The answer will surprise you. If you commit fully to a whole food, plant-based approach, the changes begin before you could ever measure them on a scan. Significant, measurable drops in cholesterol are commonly seen within 14 days, not 3 months, 14 days. The soluble fiber is clearing cholesterol from your intestines with every single meal. The nitric oxide from your greens is already improving blood flow within hours of eating them. The anthocyanins from your berries are already working on the membrane stability of soft plaques, reducing their volatility, and over time work to shrink and dissolve them. A daily handful of berries is not a wellness trend. It is targeted cardiovascular therapy. Your heart has been beating for you every second of your entire life, without a single day off, without a single complaint, without ever asking for anything in return. It is pumped over 2 billion times for you before most people even begin to think about taking care of it. The mystery of heart disease was never a lack of medicine. It was never a lack of surgical intervention. It was a lack of biological fuel, the raw materials your body has always needed to do exactly what it was designed to do, which is heal itself. Beans instead of beef, oats instead of eggs, berries instead of butter, greens instead of grease. These are not dietary restrictions, they are biological permissions. Permission for your body to finally stop building the blister and start tearing it down. The silent architect is real, but so is the demolition crew, and it has been waiting in the produce aisle your entire life.